Dr. K.R. Sadhana from the Department of Prosthodontics, Assistant Professor, Sree Balaji Dental College and Hospital. Today the topic of discussion is about casting defects. Before moving on to the topic, I want you all to imagine yourself as a chocolate maker. What a chocolate maker will be doing, will melt the chocolate and pour it on the mold and will wait for the chocolate to set and then will pop out the chocolate from the mold, right? The same thing is going to happen in case of casting procedure in dentistry. Now imagine what if the chocolate has not obtained a desired shape, that is referred as distortion. What if the chocolate is full of porosity and voids inside and outside the chocolate, that is called as porosity. What if the chocolate is of impurities and dirts and irregularities on its outer surface, that is called as surface irregularities and roughness. What if the chocolate is not in chocolate in color, brown in color, or it has obtained some blackish spots on the chocolate, that is called as discoloration. And imagine the situation where the molten chocolate is not flown entirely onto the cast, that results in an incomplete chocolate, right? That is called as incomplete casting. So these are the 5 defects in casting procedures: distortion, surface roughness, discoloration, porosity and incomplete casting. We will see one by one in detail. Now coming to distortion. Distortion refers to undesired changes in the shape or dimension of the casting pattern or the final restoration, resulting in a poor marginal fit and functional inaccuracies in the prosthesis. So this distortion can occur at various stages. One such stage is wax pattern stage, where the wax itself will release so much of stress during carving, sprue attachment and even storage of the wax. Also, wax is highly susceptible to distortion because of its low melting point and high coefficient of thermal expansion. The second situation where this distortion can occur is investment stage, where the expansion of investment, that is the setting expansion, hygroscopic expansion or even the thermal expansion, can alter the pattern geometry. If the investment fails to adequately compensate for metal shrinkage, distortion occurs. The third stage where this distortion occurs is casting stage, where the improper heating or cooling cycles, thermal contraction mismatch can result in distortion. Incorrect sprue placement can sometimes contribute to localized shrinkage and warpage that can result in distortion. So now let us see how we can prevent these types of distortions. The first one is wax distortion, where the wax is highly stress released. Distortion occurs if the wax is stored for a longer duration and subjected to higher temperature. So in order to avoid this, we can invest immediately after the wax up, that is preferably 30 minutes. Some other textbook says within 1 hour. So we have to invest the wax immediately and store the wax at the room temperature if the delay is unavoidable. Sprue design and attachment plays a crucial role in avoiding the distortion. Incorrect attachments such as thin, oblique or sprue attachment near the critical areas can cause localized shrinkage. Attach sprue of 2.5 to 3.5 mm diameter at the thickest portion and the length of 3 to 6 mm and attach it smoothly. Also have it in mind that the sprue should be attached at a 45-degree angle at the bulkiest portion of the wax pattern. Setting and hygroscopic expansion of the investment. Incorrect water powder ratio can also contribute to distortion. So always maintain the manufacturer's instruction for water powder ratio and transfer the investment ring to the water bath within 30 seconds of the hygroscopic expansion. Coming to the heating and cooling distortion, rapid heating or cooling causes crack or warpages. Base metal alloys are more prone to distortion due to the higher casting temperature and higher shrinkage. This can be prevented by controlled heating, that is, placing the ring at the preheated furnace and allowing it for the gradual rise in the temperature. Do not quench the base metal alloys. Coming to the casting pressure or technique, inadequate casting pressure or sudden impacts lead to the distortion or incomplete filling. Maintain the recommended casting force, that is centrifugal or air pressure, as per the alloy requirement. Now coming to the second type of defect, that is surface irregularities and discoloration in dental casting. Surface irregularities and discoloration are common casting defects that adversely affect the fit, function and aesthetics of the fixed prosthesis as well as the removable prosthesis in case of cast partial denture. Coming to the second type of casting defect, that is surface irregularities and discoloration in dental casting. Surface irregularities and discoloration is the common casting defect that adversely affect the fit, function and aesthetic in case of both fixed prosthesis as well as removable cast partial dentures. These defects arises due to the interaction between the investment material, molten alloys and the surrounding environment during the casting procedures. The surface irregularities are defined as macroscopic roughness, nodules or pits that present on the casting surfaces caused mainly by mechanical factors such as air entrapment, investment damage or improper sprueing techniques. Discoloration, which is also referred as surface chemical reaction defects, results from chemical interaction between the molten alloys and the investment material or the residual oxides, producing dark, discolored or rough surfaces. This is more common with base metal alloys because of their high affinity for oxygen, sulfur and carbon. Both the defects compromise the longevity of the processes, increases the chairside finishing time and may reduces the patient acceptance. Now we will see in detail about the causes for these defects and how we can prevent it. The surface roughness, that is primarily due to the coarse investment particles, which can be prevented by using a finer investment particles, and also one of the reason for coarse investment particles is the improper water powder ratio that can eventually lead to weak and porous mold. So always stick on to the manufacturer's recommended water powder ratio, apply the thin wetting agent, air dry proper sprue design to prevent a direct impact. The other type of surface roughness is one such as nodules or small bumps. Air bubbles adhering to the wax during investing, dust or contamination on the wax pattern, entrapped investment particles can result in this. So this can be prevented by vacuum mixing or investing, cleaning the wax pattern before investing, gentle vibration during pouring the investment can be done in order to prevent the nodules and small bumps upon the casting. The other type of surface roughness is fins and spines. These are tiny projections upon the casted prosthesis. Cracks in the investment due to rapid heating or cooling or excessive thermal expansion of the mold or low strength investment can result in this. This can be prevented by gradual heating and cooling, adequate investment strengthening, avoid rapid temperature changes. Coming to the discoloration, that is the surface oxidation or the blackening, this is primarily due to the sulfur contamination from the torch flame or the investment breakdown, carbon contamination from the crucible torch or wax residues. Prolonged heating causes oxide layer formation. These things can be avoided by using a clean, neutral or reducing flame. Avoid overheating, that is more than 700 degrees Celsius for gypsum bonded investment. Use a clean crucibles, proper burnout of wax, light pickling to remove oxides, whereas sulfur layers resist this removal technique. Coming to the third type of defect, that is porosity. Porosity is the presence of voids within the cast which may occur internally as well as on the external surface. Internal porosity weakens the casting, and when it reaches the surface, it may cause surface roughness, discoloration, thereby plaque accumulation and thereby secondary caries and periodontal diseases. Porosity cannot be entirely prevented but can be minimized by proper techniques. The porosity can be broadly classified as solidification defects and trapped gases. Under solidification defects, it can be categorized as localized shrinkage porosity, microporosity and suckback porosity. In case of localized shrinkage porosity, which is caused by premature termination of metal flow during solidification, usually near the sprue casting junction. Microporosity, these are small irregular voids formed when the solidification is too rapid, often in fine grained alloy casting. Coming to the suckback porosity, shrinkage voids in areas where the hot spot retain molten metal longer, usually at the interior line angle. Coming to the trap gas porosities, first one is pinhole porosity. These are the small surface voids caused by dissolved gases, particularly oxygen and hydrogen released during solidification. Gas inclusions, which appears as a larger spherical voids caused by mechanically trapped or incorporated gas during casting. Subsurface porosity, these are the voids beneath the surface, that is subsurface, possibly due to simultaneous nucleation of the solid grains and gas bubbles. Back pressure porosity, these are the large concave depressions caused by entrapped air that cannot escape due to the dense mold, vacuum investing or clogged mold pores. Now let us see what are the possible causes for these porosities and prevention of these porosities. Localized shrinkage porosity, these are the void formed due to the premature termination of the molten metal. This can be prevented by proper sprue and reservoir design, adequate casting pressure and ensuring continual metal flow. Coming to the microporosity, which is caused due to the rapid solidification, low mold or casting temperature, this can be avoided by controlled molding and casting temperature and proper burnout. Suckback porosity, which is shrinkage void at the hot spot, often at the interior line angles, which is caused due to the molten metals impinging on the mold surface, and hot spot retains molten metal longer duration. So this can be prevented by rounding the internal line angles, reduce the mold metal temperature and using of the proper sprue design. Coming to the pinhole porosities, that is caused due to the dissolved gases, oxygen and hydrogen expelled during solidification, and alloy contamination can also contribute to the causes. This can be prevented by complete burnout, pre-mill previously used alloys, clean and uncontaminated investment materials. Gas inclusion. Large spherical voids, that is mainly due to the mechanically trapped or incorporated gas during casting, that can be prevented by using a correct torch flame in reducing zone, pre-melting the alloys and proper venting. Coming to the subsurface porosity, these are the voids beneath the surface. This is due to the simultaneous nucleation of the solid grains and the gas bubbles at the mold walls, that can be prevented by controlled rate of molten metal entering the mold and adequate mold venting. Back pressure porosity, these are the large concave depressions that is caused due to the entrapment of the air due to the dense investment, vacuum investing, residual carbon and low molding or casting temperature. This can be avoided by limiting the investment thickness less than or equal to 6 mm, adequate mold venting, proper burnout and maintaining the mold cast temperature. Coming to the last type of distortion defect, that is incomplete casting. The incomplete casting occurs when the molten alloys fails to completely fill the mold, resulting in the partially formed or the absent casting. This schematic image illustrates the incomplete casting, and also this image, the image on the top right corner implicates the incomplete casting resulting in incomplete wax elimination, that is resulted as a rounded margin and shiny appearance. Coming to the different types of incomplete casting, the possible causes and the prevention mechanism. So, we will see one by one. Insufficient mold venting. This is mainly due to air in the mold creates a back pressure preventing the molten alloy from filling the cavity. Low casting pressure cannot overcome it. It results in rounded or incomplete margins. This can be prevented by ensuring the adequate venting of the mold, maintaining the sufficient casting pressure for a few seconds beyond the solidification. The second cause is residual wax or combustion products. This is mainly due to the incomplete elimination of the wax, leaving the carbon residues. Contacting with the molten alloy may cause explosion. Shiny rounded margin form due to the reducing atmosphere. This can be prevented by complete wax burnout, proper investment preparation and removing the combustion products. Coming to the third cause that is contributing to the incomplete casting, that is high viscosity of molten alloys. Low temperature increases surface tension and viscosity. Alloy solidifies prematurely before filling the mold, and white gold alloys are more susceptible for this damage. This can be prevented by heat the alloy above the liquidus temperature, ensure proper torch adjustment and avoid premature solidification. Coming to the low water powder ratio of investments, denser investment reduces porosity but may impede air venting and restricting alloy flow. So, this can be prevented by adjusting the water powder ratio and increasing the casting pressure and ensuring the mold venting. Incorrect casting technique can also lead to incomplete casting. So, improper sprue design, insufficient pressure or short pressure application time can contribute to the incomplete casting. That can be prevented by following the correct sprue design, maintaining the casting pressure for adequate time and proper handling during the pouring. So, coming to the conclusion of today's topic, casting defects in dental restoration including distortion, surface irregularities, roughness, discoloration, porosities and incomplete casting can significantly affect the fit, strength, aesthetics of the prosthesis. Total elimination of the defect is difficult. Careful attention to alloy temperature, mold and sprue design, casting pressure, burnout procedure and proper handling technique can minimize their occurrence, ensuring durable, precise and aesthetically acceptable restoration. Thank you. I'll meet you in another video.